Hi, Dr. George Springer. This is our continuing series of patient successes to kind of really profile a lot of things we accomplish here at LifeWorks. This particular segment, I'm going to talk about gastrointestinal issues. And I say that in kind of a broad term because it could be IBS or IBD or Crohn's disease or ulcerative colitis. And these are all terms out there that label different conditions that medically they want to label them because their treatment is slightly different. Here the label doesn't make as much difference because, quite frankly, the mechanisms that are there in place that cause these conditions are much the same, regardless of what the label is. And that was the case with one of my next patients I'm going to talk about is John. John had suffered for 20 years with ulcerative colitis, where he'd had many bowel movements a day. In fact, his bowel movements really ruined and really kind of had to plan around his bowel movements for his whole life. If they were going to take a road trip, he had to figure out where the exits were on the highway so that he'd be able to get off quickly. If they went to a movie theater or to any kind of function, he had to sit on the end because he didn't know exactly when he was going to need to get up. And this had been going on for years, and that's the best that was being managed, unfortunately, medically for him. So his wife came in first. She had allergies. We were able to help her, and so John said, well, let's take a look. And the long and short of it is that John no longer has to worry about what exit he might get off on the highway. He actually can go fishing in his boat, which is one of the things he loves to do, without worrying about is he going to have some kind of situation that exists there. And the real key to getting to fixing a situation like this is, again, to get to the cause. If there's one hallmark we have here at LifeWorks is we not only treat things naturally, but we actually get to the cause, or more appropriately the cause is, of why these conditions begin to develop. And digestively, most people know I taught gastroenterology, so really working with the digestive system is something we really love doing, and it's also something that's really at the core of so many other health conditions. You may be coming in for something else altogether, but your digestive system is the core not just of how you digest your food, but also our overall immune system. 80% is estimated to be in the gut, and also even things like neurotransmitters, serotonin, can be affected tremendously by digestive function. So these things are all symptoms that sometimes wrap up into what is termed a digestive issue, but there's really much more there than meets the eye. So if you have a digestive issue, we'd love to help you with it. They respond very quickly, and so we're happy to have you come in and see us. All right, see you next time.